Hi, everyone. Sorry for not announcing the subject of Wednesday's live this week, but I'm very excited for it because I'm going to be talking today all about free-handed technique and how free-handed technique looks in Japanese acupuncture and how to start actually being able to do it. So for those who are in ShinKyu University already, you know for a fact that one of the main techniques that I teach is a technique called nenshin. Nenshin literally means drill technique. We're going to be going over today nenshin, and then also another technique called okurikomi, or often what you learn as lifting and thrusting, but it's going to have a little bit of a twist. So do stay tuned for that. So without further ado, I'm going to get off camera. We're going to put the camera down on my hand so you can see what I'm doing. Now, just a side note is that you always want to make sure that whatever you're treating, you're going to want to be at least facing your point. You can notice right here that my dantian is actually a little bit lower than my needle pillow, which is going to take the place for my patient today. Ideally, you would want your dantian to be at the same level. In order to facilitate a little bit better posturing. You want to make sure you have 2 feet nicely planted on the floor and that you're not holding your shoulders. I'll show you a little bit. You're not holding your shoulders like this or posturing a little bit funky. Okay, so I'm just going to show you sitting down for this demonstration, but realize that, honestly, I should be right here and I might change my mind for part of it. Anyway, so we're going to start, of course, with our oshide. The oshide is a huge part of Japanese medicine. That is your left hand, not your right hand. So really, it's your non-dominant hand. So if you're a left-handed person, it's the opposite. And so our oshide is there to not only find our point, to close our point or leave our point open, but also to give both vertical and horizontal pressure on the needle. It's there to stabilize, give you a little bit better view. It's there really to stabilize the shaft of the needle. And this is the biggest difference, I would say, between Chinese style free-handed needling or TCM style free-handed needling and Japanese style free-handed needling. Japanese are always going to have their oshide, again, their non-dominant hand there to support the shaft and to give it more tensile strength as you insert that needle into the body. So with nenshin, and by the way, this is a 20 by 50 silver needle, which is why it looks very flimsy. As you can see, it's a lot harder to insert a silver needle over a sarin because it doesn't have coating on it. And silver is also a little bit more receptive to the body. So we're going to start doing nenshin. I believe I've done a video on the past in this, but it's actually quite a difficult technique. Notice that with my hands, I'm not doing this. Breaking my wrist is what I call that. And I'm also not doing this. Both of those are going to close off your flow of ki. As much as you can, you want to have a nice round posture with both hands. And then notice with my right hand, my dominant hand, it's going to be an extension. I've talked about this many times. Your needling hand, your fingers should be an extension of that needle rather than cut off from that needle, which I think is a more common way to hold your needle. So again, I'm going to make my oshide around my needle. We're not going to talk too much about the oshide today because it's actually quite complicated. We're just going to do the nenshin. Now, the nenshin I like to refer to as a little bit of a Parkinson's twitch. If you want to watch my my needling hand's thumb, and I'll stand up so I have a better posture here for you guys to see. So the thumb here of this hand is going to twitch. And as it twitches, notice I'm not turning it like that. That's painful in the body. All I'm doing is utilizing the movement of this drill to slowly insert the needle. Now, I'm not pushing on this needle. You'll notice that if you push too much, especially with the silver needles, you'll end up bending them. And then I'm also not forcing it in with my oshide here. That is another technique that you can do, but really for nenshin, you want to be careful about doing that. So for the nenshin technique, I was taught that you want to get nenshin in, the needle in with nenshin to needle top mox depth, with meaning that it has enough dexterity to hold needle top mox on top of it within 3 minutes. Ideally, you want to put it in within about 5 seconds. So, right, you want to be quite quick about it. And then you also want to be very exact. And so if you notice, I have a little bit of a dot on my pillow here, and I want to make sure that I am in a specific point on that dot, a little bit outside of the dot here, which means I'm not being perfect about my needling. So there's a lot of things to be thinking about here too. And when you take your needle out, taking a needle out is the same as placing the needle in. So you always want to take it out at the same speed and ideally with the same technique as when you put it in, unless you're doing a very specific tonifying or dispersing needle technique. And then that would be slightly different. Okay, so I've done this technique. Now, this technique is really good. I'm going to talk to you about what this technique is as I show it to you. So again, I'm placing my needle. I'm going to do this without my left hand, and I'll show you how much that needle starts to turn without the shaft. You can do it without your left hand balancing that shaft, but what happens is the tip of the needle is going to be have a lot more play to it. And so rather than going like this into the body, it's going to go like this into the body, which makes it actually quite painful, which is why a lot of people have difficulty with free-handed techniques. And so in order to stop that shaft from doing this and rather do this straight line into the body, you're just going to use your oshide again. And that oshide is going to control the shaft. Now, nenshin technique is a great technique for tonification, but it also is a great technique for dispersion. Now, originally, I would say nenshin was utilized for dispersion because as it slowly goes into the body and then slowly comes out of the body, it's gathering a lot of ki and then able to slowly pull that ki out, kind of like a fisherman that is doing fly fishing. There we go. So you want to slowly pull that line out. Now, that's way different than okurikomi. Now, what you often refer to as lifting and thrusting, which most TCM practitioners I found do in order to grab and initiate chi sensation at that point. Lifting and thrusting in Japanese medicine can be used for that, but it's also used to get to a specific place in the body as quick as possible. And so if you want to think of it this way, we'll use my little teishin case here because it has layers. Let's say that the point that you want to activate and the key that is deficient is down here at this very bottom layer. Well, if you start doing lifting and thrusting up here at the top layer, let's say at the skin surface, it's going to gather the key there, but it might not gather it here. And so the lifting and the thrusting, this okurikomi, is really used to get your needle down to this specific depth as quick as possible, with hopefully gathering the least amount of chi as possible there. So, and then once you're there, then you can start doing things to actually activate it there, whether it's the nenshin technique or lifting, thrusting, whatever. In order to do a kurikomi, so we're going to start with the same way. So I'm going to start on the surface, right? I'm going to use my oshide here to really solidify and add that tensile strength to the shaft. I like to put my middle finger and my ring finger down as a little bit of a guide. And then if you notice, I might have my index finger straight. That's also a guide, but I really am only holding on to the handle. And then what you're going to do is push down with this lifting and thrusting to that specific depth, and you're going to want to get it in quite quickly. And all I'm doing is what I like to do. Let's say we have layers here of the body, right? What I'm doing is I'm putting in 2, I'm bringing it up 1. I'm putting in 2, I'm bringing it up 1. I'm putting it in 2, and I'm bringing up 1. And if you can have this ebb and flow of your needle into the body, what it's going to do is it's allow the body to relax with that needle insertion rather than grabbing onto it, because a natural ebb and flow is what the body's used to in the blood circulation. So again, lifting and thrusting, or kurikomi in Japanese, is a much different technique than nenshin. Oftentimes, people think Japanese acupuncture, that means that there has to be a guide tube. There has to be a guide tube tap in. We can talk about that tap in at another time. And then after that, we just leave the needle as it is, because all Japanese needling is supposed to be superficial and gentle. That is 100% completely untrue. That is a technique of Japanese acupuncture. But in actuality, before this guide tube was invented by Sugiyama Waichi, they had free-handed techniques. Sugiyama Waichi invented the guide tube actually out of a piece of bamboo because he was apparently not a very good free-handed needler, is how the story goes. Whether that's true or not, I don't know. So you can definitely use your guide tube to pass that first layer of insertion, that skin layer that can be so sensitive with the wei qi. That's not a problem. But ideally, with the free-handed techniques, you're going to start at the skin surface. Again, at the skin surface, I like to do a little bit of, I go to the skin surface and then I'll bring it up a little bit. And then I insert, and then I bring it up a little bit. And then I insert, and then I bring it up a little bit. And then I insert. Now right here, it looks like I'm just using my hand, but really, if I have the better posture, which means my dantian is in front of what I'm needling, I'm going to insert. I have a little bit of there we go, a little bit of a rock underneath there, hard place, I should say. But you see how I'm not just going here at one place, and I'm not just using my fingertips. I'm using my whole body to go in two, bring up one, go in two, bring up one. So you can do this either by messing with your horse stance here, or by simply changing your posture a little bit and not having to mess with your knees. I would say that's a safer bet to continue to hold strength in your dantian and not to hurt your knees. All right, so those were two entirely different techniques. One, nenshin, which is used originally, again, for a very dispersive technique where you insert slowly, you take out slowly, and then we have okurikomi, or the lifting and thrusting, right? Which actually is used a little bit less for gathering that chi there and a little bit more to get to the level of the body that you want to get to as quickly as possible. So two very, very different free-handed techniques. Both, I would say, are actually quite difficult. Free-handed techniques are not easy, especially when you're using a 25 by 50, a 20 by 50, excuse me, of silver. Now, if you're doing a free-handed technique with like a sarin or a really thick Chinese gauge needle, yeah, it's not super hard because the needle is super thick and it can handle itself without having to use your oshide. But when you use a needle that is as delicate as silver 20 by 50 needles that have a really long shaft to them, they're a little harder to control. That's when you really start to see how good your technique is or how bad it is. So I highly suggest getting some silver needles if you can. If you become a member of ShinKyu University, I actually gift every single student 10 silver needles of 20 by 50 gauge because I want them to start utilizing these needles. I also gift some moxa and some other fun stuff to really help start your practice. So if you're interested in continuing to learn this technique, one of the things that we do in ShinKyu University, well, these two techniques, one of the things we do in ShinKyu University, besides having a ton of recorded content, is we also have live monthly study groups where we get to watch each other's practice and critique it. So usually that means that I am looking directly at your hands and your body and saying, you're not doing this correctly. You need to change this or that. And then you can ask questions about like, okay, how do I feel this, or how do I apply it? And we can really work through the material together. After that, then the next stage is, of course, doing a in-person lecture, which are so much more fun. And so we have a few of those planned for next year. When I figure out the exact dates, I will release all of them to all of y'all because I would really love to do some in-person lectures for everybody. Even if you're not a member of ShinKyu, I would love for you to come to one of those. So saying that, I'm going to go ahead and sign off for today. Thank you so much for being with me and spending your time, energy, and effort learning this amazing medicine. If there's anything in the future that you would like to learn more of, please be sure to put it in the comments below, and I will try as best as I can to accommodate your learning goals. And if you want to learn more and have more of this one-on-one instruction, please do join ShinKyu University. It is an amazing program, really built to bridge that gap between the Japanese educational system in acupuncture and the TCM educational system. So it's a really great program, and I'm very, very proud of it. And I would love for you to join and really up your skills so you can help more people in the clinic and you can learn better from advanced Japanese acupuncturists, more advanced material, quicker, faster, and have all of those questions of I don't understand why and when go out the window because you understand the foundation. All right. Saying that, if you're interested in more theory, I do have a lecture coming up on the white pine circle this Friday. It's one of a 4-part series talking about the mechanism of disease, which is an Eyashi theory, and taking the Shanghanlun and saying, how can we start applying the Kampo theory to our acupuncture and moxibustion? I would love for you to join. They are mini classes, so they're only an hour each. You can head over to the white pine circle to check those out. They do offer, I believe they're going to offer CEUs for them as well, for those of you in North America. Cool. So don't forget to like, subscribe, hit the little bell to be notified of future videos coming out on this channel all about Japanese medicine. And I am so excited that you were here with me today. I hope you have a great evening or morning. And yeah, keep practicing.